Plastic surgery is transformation. Whether cosmetic or reconstructive, doctors are changing lives. Real stories, groundbreaking procedures, ultimate makeovers. This is plastic surgery, before and after.
Hi, I'm Jan Adams, a plastic surgeon from Laguna Beach, California. Some people think of cosmetic surgery as elective, but for trauma survivors, it's essential. In this episode, we'll meet a courageous teen who barely survived a brutal attack. Cutting-edge technology will help erase his wounds, both inside and out. Then, what began as a harmless freckle on a young woman's face grew into a horrific ordeal. The defect was diagnosed as cancerous, and treating it turned her life upside down.
Up next, we'll meet a 15-year-old boy who is devastated by the appearance of his chest. Sports have always come naturally to Eric Robertson, a 15-year-old living in Phoenix, Arizona.
When I was younger, I used to play a lot of sports, so I was very active.
But when Eric was 10 years old, he noticed his body changing.
One day, one of the kids mentioned that I had man breasts, and that was the first time I realized that I was different.
Eric suffers from gynecomastia, a condition where males develop unusually large breasts.
My chest looks like what a female would have, like as far as breast goes.
He wears a compression garment to flatten his chest.
Because it's really, really hard to get on.
Eric stopped playing sports because he felt self-conscious about his chest.
When other people are playing sports, I wish I could play with them, but then I think that they're just going to make fun of me because of my chest.
Tired of sitting on the sidelines, Eric decided to find a solution to his problem.
I went on the internet and did research on gynecomastia, and I found all these surgeons.
I want to give him the benefit of enjoying his teenage years and not suffering low self-esteem like so many children do. So I'm going to let him have the surgery. I think it will be beneficial for him.
After months of research, Eric travels with his mom to New York City to consult with Dr. Elliot Jacobs, an expert in treating gynecomastia.
Morning, Eric.
How are you?
Now, I understand you have a problem with your chest and you've researched it over the internet, so that's great. I hope that we'll be able to help you. What I would like to do is to take a good look at you.
Okay.
Okay. Can you put your arms up for me? Okay. Let's take a look. Any pain or tenderness?
No pain or
Nothing
tenderness.
at all?
No.
Okay. What I'd like you to do next is put your palms together down here. Stand up straight, push hard, and show me your muscles. Okay? And when you do that, look down and you'll see that there's not a lot of tissue here, but then this is all excess breast tissue. And so the diagnosis is straightforward. That is pretty much solid breast tissue, and we're going to be able to help you and get you nice and flat. Okay? Any questions?
Yeah, what about these stretch marks I have here? What will happen to those?
Okay. Unfortunately, those are probably going to remain after surgery, but hopefully you'll grow a little hair on your chest and it'll obscure them.
Okay. How soon after surgery will I be able to play sports again?
We're going to put you into a compression garment, and you're going to wear that for about 3 to 4 weeks, and during that time you cannot indulge in sports. After about a month, you'll be able to perform in sports, you'll be able to take your shirt off and go swimming, and you should look pretty normal within about a month, although they're still healing afterwards for a number of months.
Okay. And then I had another question. Is there any chance that my chest may become bigger again after surgery?
No, this is a cure. I've done a lot of young boys such as yourself, and I've not had one person have a recurrence where it did regrow. So we're going to schedule your surgery, and I will see you in the operating room sometime soon.
Okay, thank you.
All right? Very good.
Ready for his transformation, Eric arrives with his mother for surgery.
Of course, I'm nervous because it's major surgery, but I have every confidence the procedure is going to change Eric's life.
Today is the day. These are your before pictures. Now, the next thing we're going to do is mark your chest for surgery. This doesn't hurt, it actually tickles a little bit. Here we go. Eric's a 15-year-old boy who has excessive breast tissue, and the whole concept in this surgery is to try to make him as flat and as normal looking as possible.
And slowly you'll just drift off to sleep.
So here we go.
Dr. Jacobs injects a local anesthetic into Eric's chest to begin the surgery.
My first incision is going to be in the armpit. We try to hide that, and that'll be a tiny little scar that will eventually look like a little white blemish.
Next, half a liter of tumescent fluid is injected to prep the breast.
This fluid does three things. It has medication to further numb up the breast tissue. It has medication to cut down on bleeding. And most important, the fluid itself serves to make all this tissue soft and mushy and easier to remove.
The liposculpting procedure begins with the cannula inserted into the right breast.
So what I'm doing now is literally grasping the breast tissue and spearing it, almost like a shish kebab, and trying to remove that dense breast tissue. All right, we've completed the liposuction on the right breast, but there's still remaining dense breast tissue here so that it prevents it from being nice and flat.
An additional incision is made to remove the remaining tissue.
What we're gonna do is cut around the nipple in a semicircle, kind of a smile, and right away you see that white tissue popping up. That is breast tissue. This is the tissue that we have to remove. I think there's a fallacy with gynecomastia, that you can work it out.
A common misconception with gynecomastia is that it can be corrected by exercise. If Eric Robertson develops his pectoralis major muscle, it serves to push the breast tissue out further, making the condition more noticeable. Bottom line, gynecomastia will not be reduced by working out. It's a medical condition that requires a surgical solution.
The doctor finishes removing the remaining breast tissue.
Okay, we finished the right side. You can already see the difference between the right side, which is smooth and flat, and the left side.
Dissolvable sutures are used to close the incisions.
The stitching is done in 2 layers.
The procedure is then repeated on the left side.
This tissue is thicker than the tissue we removed on the right side. There was no way I could have suctioned this. This is too dense.
Reducing the size of the breast will also affect the size of the nipple.
The nipple itself will shrink about 15 to 20%.
Dr. Jacobs checks if both breasts are symmetric, then sutures up the incisions
That's my final stitch.
to complete the 90-minute procedure.
Okay, everything went just fine. I'm very pleased with the surgery. I'm convinced that within a month, we're going to be watching Eric on the basketball court, enjoying himself at the pool. This will definitely change his life. Hello, Eric.
Hey, Jacobs.
If you turn sideways, you're going to disappear. How do you feel?
I feel really good.
That's good. I'll check in a little bit.
All right, thanks, Dr. Jacobs.
You're welcome. Okay.
Thank you.
Will Eric Robertson get the flat chest he needs to get back in the game? At the age of 10, Eric Robertson began to develop gynecomastia, a condition where males grow female-like breasts. Eric wasn't the only one to notice.
One of the kids mentioned that I had man breasts.
Deeply ashamed of his appearance, Eric gave up what he loved most, sports.
Anything that has to involve taking off my shirt in public is my biggest nightmare.
Can you put your arms up for me?
To flatten his chest, Eric underwent surgery with Dr. Elliot Jacobs. It's been 6 weeks since his surgery, and Eric is back in the groove.
I feel like a whole new person. I'm not as self-conscious as I used to be. I feel more confident when I go up. I know that people aren't staring at me anymore because I don't have a chest that looks like a female. I am very happy with my results. When I look in the mirror now, I see a flat chest. It's easier to get dressed in the morning. I'm very excited that I don't have to wear a compression garment anymore because it's just really uncomfortable. All I have to do is put one shirt on and I'm out the door. Now that I've had the surgery, I look forward to playing sports again because that's what I miss most. I don't worry about taking off my shirt in public anymore because I know that people won't be staring at my chest because it's flat. This experience has changed my life. I'm very proud of myself for doing the surgery because now I can enjoy my teenage years and not have to worry about my chest all the time.
Eric Robertson is not alone. Last year, over 16,000 men and boys were diagnosed with gynecomastia in the U.S. alone. Whether it's cosmetic or reconstructive, there's no doubt that plastic surgery is on the rise. And we, the doctors, will continue to find ways to improve procedures and provide our patients with the best care possible. I want the patient to be happy. That's the bottom line. I'm Dr. Jan Adams. Thanks for watching.